Hi. I'm a little nervous. All right, my name is Carly Domhoff, and I am a member of Put People First PA and a coordinator in the South Central region. We are a politically independent, staff-free, member-led group of the poor and dispossessed working class. We are politically independent and member-led because we understand that no one is coming to save us. We have to save ourselves together. And we can. I mean, it is us, the poor and working class and marginalized, that keep this whole society running. We're the machine operators, the button pushers, the package movers, the service providers. Us. We serve each other and bandage our wounds. We know what deeds done and we get it done together. Yet, we are unable to meet our own needs. There are 140 million poor people in this country, and that number grows every day because no matter who is in charge, the war on the poor continues. In our system, we are denied our basic human rights. In the richest country in the history of the world, in Put People First, we have been organizing people across the state around their healthcare struggle and our Human Care as a Human Right campaign. Healthcare is a human right. I want to share my story because I know it's not unique, that there are millions of people like me out there, and that real change begins when we tell our stories. Years ago, I was having severe dental pain and had a few fillings fell out. I delayed care because of the lack of insurance, and when I got Medicaid, I was told I had dental insurance. I was told I needed root canals on a few of my teeth. But root canals are not covered in PA because the Obama administration advised the state to cut the adult dental benefit in 2011. So instead I was told for a standard necessary procedure that it would cost thousands of dollars out of pocket. I am poor. I don't have a few $100 floating around. I was prevented from receiving actual treatment. What remains covered in PA are extractions. 1, 2, 3, 4 teeth over the span of a few years were ripped out of my mouth because of the fillings. Each pain was excruciating, so each time, each exam, each assessment, each devastation. And then when the tooth was removed, the pain is gone. I was grateful. But why does the system require us to suffer? So that we are grateful for the little suffering, to suffer a little bit less. We are required to be chronically neglected, train ourselves to ignore ourselves and our needs and our pain. We are living in poverty amidst plenty, and no matter how hard you hustle, how hard you work, something always comes up. And we are taught that it's our fault. We are blamed. We have poor time management. We're bad with money. It's not true. It never has been. To be alive in this country is to be born into a hostile, psychologically terrorizing situation. We're told we must earn a living. We're taught to fear, and mistrust one another and distrust ourselves. We're taught from birth that we must jump through hoops to have the chance at an opportunity. But the first promise of this country is that everyone has a right to life. How can you have a right to life if you don't have a right to health care, to housing, to the basic things we need to live? I used to struggle with anxiety and depression. I was hyper-judgmental of myself and others. The language I used to describe myself and my reality were harsh, unkind, untrue, cynical, and apathetic. Hopeless. This is the normal narrative. I wasn't weird for thinking those things. That's the language we're taught. It was not about, I thought, I got the grades, I graduated college, I smiled and was so thankful for the opportunity, jumped through the hoops they created just to be able to participate in life, to be involved in the world around me. It was not about me getting anything right in isolation or suffering in isolation. I needed to get organized and to break out of it. I learned that I'm allowed to be myself and not fake who I am, that I can be a leader in my community and help build a movement for the long haul. For Dr. King's call for a fundamental transformation, a revolution of values that puts people first. The attacks on Medicaid that the current administration are proposing would be devastating for our entire country, poor or not. Only the rich and powerful benefit from the war on the poor. But that was the war that has been going long before this administration. Put People First has been organizing our Medicaid Cuts Organizing Drive when the Biden administration cut 5 million children from Medicaid. 1 in 12 Pennsylvanians lost their health care. 1 in 12. Rural, urban, black, white, Latina, Asian, old, young, gay, straight, trans, cis. 1 in 12 people were told they didn't matter. Their health didn't matter. I know you're here because you're scared and upset and isolated, but we've got to get organized and change the system. We have to put power in the hands of the people. It's going to take more than powerful gatherings like today. It's going to take organizing together every day in small and in big ways. We have more in common than what puts us apart. We have to answer Dr. King's vision when he said, power for poor people will really mean having the ability, the aggressiveness, the assertiveness, and the togetherness to make the power structure of this nation say yes when they want to say no. Thank you.